Because first I needed the money.
Right now I'm like saving up to pay back my loan.
I think it sucks, though. It shows that maybe minimum wage isn't.
Because I can't afford to live here anymore.
You ain't making enough money.
Working just to survive.
Hi everyone, we'll give people a few more minutes to get on. In the meantime, if you want to introduce yourself in the chat, we'd love to know your name, pronouns, your location, what organization you're from, if you're coming from an organization. We still have a lot of people joining. We're excited to be able to talk to you all, seeing some familiar faces. We're glad you're here. Right now, we're just doing introductions in the chat as people join. We'd love to have your names, pronouns, your location, your organization. We are hosting this as a meeting rather than a webinar, so it's a great opportunity for it to be as interactive as possible for people to add in questions in the chat or resources you might know about, and be able to see your faces for those who want to share. Great to see how many people from across the country we have on here. Very excited. We still have quite a few people joining, so we'll just give people a few minutes. And in the meantime, if you want to introduce yourself in the chat. Okay, we still have a few more people joining. We'll get started in a few minutes. Feel free to introduce yourself. Just a few notes, we are recording this, and some of our Berkeley Media Studies Group staff might take some screenshots to share. If you prefer not to be in those, just send us a little note in the chat. You can send it to me personally and we'll make sure that you're not included in any photos. Okay, it looks like it's slowed down a little, the number of people coming in. I think we'll have a few more join. But why don't we go ahead and get started? We are excited to interact with you. I am Kathy from Berkeley Media Studies Group, and we'll tell you a little bit more about ourselves. Kim, if you want to go ahead to the next slide. We are here with Housing Now California, and we'll have a chance for Francisco to introduce himself too, but we are very excited to be bringing a new resource to you that we worked on around reporting on home, and it's an analysis of US news related to housing justice and health equity and some of our recommendations. So as people join, feel free to keep putting your introductions in the chat. We're really excited so many people are here. A few notes, there's live transcription. You can choose that if you want to. We are also recording, and we also may take some screenshots for social media. If you don't want to be in those, just let us know. And we also have Shaddai Martinez-Cuestas here from Berkeley Media Studies Group. She's going to be monitoring the chat if you have any logistics trouble or need anything. So feel free to put that in there. And we're just excited that so many of you are here. We know you're doing amazing work, so feel free to share your own work or what's happening or your questions in the chat as we go along. We can go ahead and go to the next slide. So I want to turn it over to Francisco, and then we'll introduce ourselves as BMSG too.
Thank you so much, Kathy. And my name is Francisco Dueñas. I'm the Executive Director of Housing Now. So excited to have everybody here and be able to share this wonderful information and support each other and continue on our quest for health and housing justice. So for those of you that are out of the state, out of California, Housing Now, we're a statewide housing justice advocacy coalition. We're building power to make housing affordable and to combat the displacement crisis. And we support what we're using as the 3 Ps, which I'm sure many of you that are working in housing justice have heard, which is protecting tenants, renters, preserving and adapting existing homes, and then producing new homes. So that's the broad cross-section of policies that we need. I would add to that also removing barriers to just getting housing itself. And ultimately, our coalition really tries to center tenants and working class communities of color who we think are disproportionately impacted by our housing crisis. And so we're really striving for greater stability and opportunity for all renters, which I like to say creates an acronym called SOAR, S-O-A-R, and passing it on back to Kathy. Thank you so much, Kathy.
Thank you.
And the full BSMG crew, thank you all so much.
Thank you. So Berkeley Media Studies Group is an organization. We've been around for about 30 years now. We research the news and other narratives about public health and social justice issues. So we typically, when we enter the housing realm, enter through the health door, and we research the news as a proxy for what are some of the dominant narratives out there that are influencing our policymakers, that are influencing what we think is possible in health, in housing, and in many other issues. And then we take that information and we do training and strategic consultation for community groups and advocates. And we also do some education for journalists. We have been partnering with Housing Now for a few years and are just really excited about the work that Housing Now does. And when we had this new resource that we'll be sharing today, it seemed like it would be relevant for a lot of the Housing Now members, as well as we work with Kresge and the health equity and housing grantees. And so then we thought we'd share it more broadly with everyone. So we're glad you could make it today. I also just wanted to note one of the things we're very excited about is that in recent years, there has been a lot of really cutting edge housing narrative research in the Bay Area, in California, and across the country. And we really see our work today being in conversation with that work. We tend to look at the news as a measure of what are the narratives out there. But it's really supplemented by different housing narrative work that's happening elsewhere that might be testing messages, that might be looking at polling. And I know some of the folks who are doing that work are on this webinar today, so please feel free to share your resources as well. Obviously, we've made big successes, but we need to do more, and so I think it takes all of us. So we're excited for everyone to be here today. And Pam and Kim will be presenting today, and I think we can just introduce ourselves as we start our own part. So I can go to the next slide with that. I just wanted to talk about one key thing we're going to be focusing on today. So we wanted to share our new resource where we looked at US news on housing and health. But we also wanted to provide folks with either a refresher on some media advocacy tools or an intro if this is new for you. And I wanted to go a little bit into what's the difference between social marketing and media advocacy. So social marketing, many folks are familiar with. It has an individual focus. It's trying to warn or inform folks. So, you know, a lot of people in housing work, we're trying to get people to sign up for COVID rent relief. So really trying to inform people how that happens. It's about getting people to make that personal change, calling that number, filling out, you know, the application. And it's focused on what messages will help close that information gap so people know how to access these resources. And this is absolutely key and critical work. And it's a little bit different than media advocacy, where we are focused more on issues and pressuring and mobilizing either a base of folks or getting them to pressure our policymakers. So in this example, you know, when we were working to extend the eviction moratoriums in California, we were really targeting our communication on legislators, and we were hoping to get policy change and really trying to focus on whose voices were out there and addressing a power gap about who gets to make decisions rather than just an information gap. We know that a lot of organizations on this call do both, and both are essential. And there are some commonalities between them, but today we're really going to be focusing on the media advocacy portion, and happy to talk later on about how it might overlap with some of the focus on helping individuals. So I'm going to pass it on to Pam, our head of research, because she is the one with her team who spearheaded this new report we have on housing and health.
Absolutely. Thanks, Kathy. It's a pleasure to be here with you all today. My name is Pamela Mejia. I use she, her, ella pronouns. I'm based in Oakland, home also of fantastic Negrito, so I got to pick the music. I was really excited about that. Thanks to anybody who enjoyed it as well. As Kathy mentioned, I'm head of research at BMSG. I've been with the organization for 12 years. And the work that I do is really focused around that first bullet point that Kathy named around identifying and patterns in media and other narratives about public health and social justice issues, including increasingly these days, housing and homelessness and housing instability issues. So I'm just going to say a couple of words before we jump into the results, because I think, and the recommendations, that's what everyone's here for. But I did want to just say a quick couple of words, one about kind of the way that we organize and think about media advocacy and communication strategy in general. One of the things we always say at BMSG is that, you know, messages is never first. What you say, how you say it, who your messengers are and what they say, very, very important, but it is always going to flow from the specific changes that you want to see, not necessarily the other way around. So again, for many folks on this call, I'm sure this is just a reminder, but just so that we're all starting from the same page, I like to ground us in the idea that we start with questions about what our overall strategy is, you know, the change that we want to see, the person or the entities with the power to make that change, the folks that need to be mobilized to affect that change. And beyond that, once some of those kind of decisions are in place and some of those kind of parts are moving, that's when we start thinking more about the message strategy components, the questions of who says what and what, you know, when they say it and to whom, and using what venues, and what does it take to get the messengers in front of the audiences that they need to be in front of. But all of those questions, I think, again, really are going to flow down from that overall strategy. So today we're going to be mostly talking about things. Now, with all this said, a lot of what we're talking about today is going to really sit in that third layer, that message strategy. But again, just to orient that everything we're talking about is going to be situated in the larger context of your overall strategy. But once those decisions have been made, then we start thinking about message strategy. And that's the what we say, and it's the how we say it. And that's where framing really comes in. Framing, I feel like, is a phrase and a concept that lots of people use in lots of different ways these days. So again, just to sort of orient us to say where we're on the kind of the same page and thinking about things in a similar way. We know that frames really affect how people make sense of the world. And we know that, sometimes for good and for ill, very small amounts of information, just a word or a phrase, can trigger a whole frame and a much deeper meaning. And so then, without even knowing it, we are all continually using frames to create meaning. But frames don't just exist in our minds. Again, this may be all old news for all of you, but just like to start with a little bit of grounding. Because frames aren't just in our heads, they're also in the world around us. And they are, they're in the language, they're in our language, they're in our media, they're in our public narratives. And one of the things that we at BMSG are particularly concerned about is news frames. That is how those frames, how these ways of making meaning are communicated and characterized in news coverage. In fact, move to the next slide. One of the questions we always ask, whatever work we're starting with, is to say, if the only way somebody knew about your issue, in this case, housing, health equity, the intersections therein, came from news coverage, media coverage, but news coverage in particular, what would they know? And maybe more importantly, what wouldn't they know? Because we know that for a lot of people, news coverage is their entry point into a conversation. It sets the baseline for what it is that they do or don't know about an issue. If you move to the next slide, I have to do a little bit less work since the 2016 election, I think, to clarify for people why news matters. I think we're much more cognizant now than perhaps we were even a few years ago of the key role that media coverage plays in shaping not only what we're thinking about and not thinking about, but how we're thinking about it. What frames are being used to talk about the issues, the problems that we're facing, and the solutions that are viable? Whose perspectives are elevated and seen as credible? What language are we using? How are we characterizing who's an expert and who gets to have a say in defining both problems and solutions? And we know that news coverage doesn't just reach the voting public, it also reaches opinion leaders. It also reaches those policymakers whose decisions shape the environments that we live in for, again, good and sometimes for ill. So it's a key question that we then want to know is if we want to be part of shaping those policy and systems level decisions, we need to be part of what policymakers and the voting public are paying attention to. And again, that's periodically news coverage. It's often news coverage. And that is, again, the reason and the rationale behind our research on media and specifically news coverage of different issues. In this particular case, news about the intersections between housing, health equity, and racial equity. Not necessarily in that order. There's lots of different things that we're looking at in this analysis and that we really prioritized as part of the study. So with that said, unless there's anything I've missed, Kathy, or anyone else, I'm gonna turn it over now to the people of the hour, the folks who are really gonna be sharing some of the information that I hope will be most meaningful and of value to everyone on this call about what we learned when we asked that question. If the only thing people knew about housing and health and equity and race came from news coverage, which again, for many people is the case, what would they know? What wouldn't they know? And what can we do about it? So I'm going to turn it over to Kim.
Thank you, Pam. So again, my name is Kim Garcia. I'm a media researcher here at BMSG, and very excited to share this work. With the support of the Kresge Foundation, we conducted a national news analysis to evaluate news from each of their grantees' areas. So their issue areas, whether it was public housing, tenants' rights, or homelessness, and all their different geographic areas. If you are interested in looking at the full report, it is in this link here, bmsg.org/housing news. And I'll just give a little context about this report. We used a news database called LexisNexis to search for housing and health equity news over a 1-year period from June 1st, 2020 through May 31st, 2021. And we selected one outlet from each of the grantees' media markets. And we used surveys from the grantees to inform our search terms. Like I said, public housing, homelessness, tenants' rights, et cetera. And we selected a random sample to do our content analysis. And in our content analysis, we evaluated a few different things, the different types of coverage that appeared, whether it was news or opinion pieces, different news hooks, why did these stories appear in the news that day, the different sources or speakers who were quoted, whether there was problem or solution framing, any assertions of responsibility or calls to action. In the next few slides, we'll just go over a few of our findings. But again, like I said, you can read the full report at the link that Shadai just put in the chat. Thank you, Shadai. So the first thing we're going to be talking about in our recommendations for communicating about housing equity and health is to bring racial and health equity into the frame. So what we found is when, racial justice and the relationship to housing and health were covered, reporters often focused on disparate impacts or troubling data points. So, this could have been the disproportionate rates of housing insecurity among Black communities, Indigenous communities, immigrants, and low-income communities. And we did find that nearly 2/3 of stories were problem-focused rather than describing solutions or quoting sources who could describe their vision for what housing and equity could look like in their communities. Occasionally, the news did elevate connections between housing, equity, and health. And most stories that connected these three issues were opinion pieces that focused on the evidence of inequity and disparities. So a rare example of an explicit connection appeared in the Philadelphia Inquirer. And this quote here says, "Homelessness is an issue of racial injustice since it disproportionately affects Black Americans. It is also an issue of health inequality, a phenomenon well documented in the medical literature. Being homeless puts people's health at risk." So again, this is just, we found very little about equity when it was appearing. It was often problem focused rather than solutions focused. And only occasionally did these connections get explicitly stated. So I'll pass it to Kathy to describe what we can do.
Thank you. And I think it's important to note what Kim said about this equity most often appearing in the opinion pieces or op-eds or editorials. And so, when we're thinking of our communication strategies, investing in those, I think, is important. I know they can be, take a long time and a lot of effort to write, but it is where equity is getting into the news, and that can often influence other articles. And, it's part of getting equity out there as part of the solution. One of the things we recommend that we work towards collectively is framing racial equity as part of the solution and not just the problem. We can put into the chat another resource we have on developing messages, but our formula at BMSG is to always include the problem, values about why it matters, and what should be done, the solution, and that creates the desired frame or message. So what Kim was saying is we most often find racial inequities in the problem, but in the news, we found very little about racial equity as part of the solution that helps us all move forward and helps us be healthier communities, healthier states, a healthier country. And so when we are able to talk about racial equity in the solution and not just data about inequities in the problem, we are really creating that vision for what we could achieve in the future. And if it's not in the news, we know that people are not necessarily thinking about it. The other step we can take as part of what to do is really uplift Black, Indigenous, and people of color as leaders and experts. Again, often when people of color are speaking, it's as being harmed by the system and as part of the problem. We would love to see more people, Black, Indigenous, and people of color as experts in the solution realm, talking about trends, talking about data, talking about their expertise, talking about what policies we should have. And we do know that when folks do that, they are more likely to get equity into the news rather than some of the other spokespeople. So anything we can do to support a broader diversity of folks being spokespeople and what they are speaking about will be helpful in shifting the narrative. I'll send it back to Kim.
Thanks, Kathy. So the next recommendation we're going to be talking about is to connect housing to health in the context of COVID and beyond. So, since our analysis was in the middle of the pandemic, it's not surprising that most articles about housing, I think 70% of our articles focused on this global health crisis. They discussed, the impacts of the pandemic on existing disparities or called for changes to address housing instability as a way of preventing the spread of the virus and supporting vulnerable communities in their efforts to recover from the pandemic. Very few stories connected housing to any other health consequences associated with housing instability. So here is a quote. It's a rare example that names housing as a social good, but still with an emphasis on the pandemic. So this quote from the Baltimore Sun: "Safe, affordable housing is a public health necessity. We do not want to see anyone lose their homes, especially during the winter and holidays, but even more so during a pandemic." So the implications of framing housing instability in the context of COVID is it cues up the idea that there are people deserving of support because of the pandemic, a situation beyond any one individual's control. But this fails to address, other systemic and structural conditions that worsen inequities in housing. So what can we do?
And here again, thinking about our spokespeople and how we support them who are able to really dive into this, but we want to illustrate that long before COVID, there have been decades of problematic policies that have exacerbated racial and health inequities. And, we do think it's a good finding that reporters during COVID were connecting health and housing. We believe, and there's research, from people who are on this call, that shows a health frame or a health narrative is helpful when talking about housing. It can help people understand why this is an issue we all need to be aware of and to tackle. But we also know that reporters work on beats and that things really shifted during COVID. Some reporters started covering a health beat, others started covering a housing beat because they were such prominent issues. But as the public loses interest in COVID, we suspect that coverage might start to get siloed again, and that housing stories won't connect to health as much unless we as advocates get it in there. And so anything we can do to demonstrate connections between equity, housing, and health, and to illustrate that the problems we're seeing now weren't caused by COVID, but have been around for a long time, and that we need systemic solutions that are equity focused, that address them. That's really what we would like to see as we move forward in the news.
So the next recommendation we're going to be talking about is to position characters to broaden the frame around housing. So in the news, we wanted to understand whose perspectives and stances were elevated and whose were obscured. And so, we looked at who was quoted and what they said or what was said about them. So what we found is landlords, not unhoused people, tenants, or advocates, were often portrayed as heroes. And they were often, framed in conflict with tenants. And often the complexities of housing policy were boiled down to a he said, she said format. Reporters often portrayed landlords as struggling due to unreasonable or untrustworthy tenants. Some articles frame landlords as harmful to tenants, but generally we found that these articles frequently use scarcity framing, which reinforces the idea that when one group benefits, another must lose. By contrast, we seldom saw stories that frame policies to expand housing resources as a win for all. So an example is this quote from the Washington Post, where we saw landlords being referred to as housing providers. So without an end in sight or any sort of financial relief whatsoever being offered to the city's housing providers, many will be forced into foreclosure. On the other hand, we also saw lots of narratives about unhoused people, but we found that the news may reinforce harmful frames and stereotypes. So although unhoused people accounted for 15% of speakers in news articles, and they were most often quoted in the Seattle Times and the Philadelphia Inquirer, they were often not quoted as experts on the issues facing their communities or tying their experiences to needed solutions. Instead, most were telling vivid personal stories about their own struggles. When they were spoken about, unhoused people were sometimes described using language that evoked fear, distrust, and kept the frame squarely focused on deficits and problems. Beyond engendering pity or fear, these individually focused stories potentially obscure the broader policy or historical landscape that could help readers understand why so many people are unhoused, or set the stage for reporting on equity-focused solutions. So one quote we saw from the Seattle Times said, residents constantly reported hostile interactions with encampment occupants who demanded money, started fights, and grew particularly angry whenever outsiders so much as glanced at them. So again, this is very much evoking fear, distrust, and focused on problem framing. So what can we do?
Similar to what I've already mentioned is thinking about our messengers and how we're supporting them. It's great to partner with Housing Now today because we've been able to see this in action. In a lot of the work around the eviction moratoriums, Housing Now really cultivated diverse sectors and communities. They had public health folks, they've had youth-led press conferences, they've worked with faith community spokespeople. And so again, if we want the news to talk about housing and health and how they're connected, and to broaden the frame around who is viewed as an expert, really supporting those messengers, is one of the goals of today, so that people have the tools they need to be able to be confident and speak effectively to the media, to write their op-eds, and really get their point across. One of the things we do at BMSG when we do trainings, we try to replicate high stakes situations. We know people get nervous, I get nervous. And so we try to replicate that so that people get used to how their nerves are going to affect their body, how hard it can be to sometimes stay on message when there's a hard question, how a lot of times reporters will really be digging into the problem. And so it's so hard to get your solution out there or to get equity in. And so anything we can do to practice and prepare messengers, especially people with lived experience, to be confident and feel prepared is really important. I'm just getting a few comments in the chat. We'll try to get to that. I had put a worksheet on message development into the chat, and that is also one of the tools that can be helpful for helping people narrow in on what they want to say to reporters.
Thanks, Kathy. So the final recommendation we're going to talk about is to expand the frame around the role of government, and roles and responsibilities of government are central to the news narrative. We found in our analysis that government was not only being included in the story, but also being called to account. And, it was interesting. We know from decades of media research that the news commonly focuses on the problem rather than on solutions. But here we found that majority of stories, about almost all stories, named a specific solution to at least one housing issue, and many solutions centered on government action. So while government officials were regularly quoted, they were equally blamed for housing problems and responsible for solutions. Many of these solutions included increases in funding or changes to state, local, or federal housing policies, We also documented explicit calls to action and found that responsibility was regularly laid at the feet of local, state, or federal government entities. And when government entities failed to act on housing, they were sometimes swiftly taken to task. So in this quote that we saw from the Baltimore Sun, without a quick and significant federal intervention, there will be a wave of evictions. Really, the wave has already started. Our work now is to prevent it from becoming a tsunami. So what can we do?
And before I dive into this, I just want to address a comment that someone messaged me. Great point about what do we mean by health when we're talking about a health frame or policies that affect health, and whether that includes mental health. Absolutely. At BMSG, we've worked on everything from gun violence to early childhood education to climate change to housing. And absolutely, we are talking very broadly about health, and that includes mental health and physical health, and not just individual health, but community health, like how healthy our neighborhoods are, what access our neighborhoods have at the community level to resources, or what barriers neighborhoods face, and what we can do as public health workers to ensure that both people and neighborhoods have what they need to be mentally and physically healthy. So thanks for asking for that clarification. So in what to do about expanding the frame around the role of government, we were glad to see that government was mentioned as part of the problem and solution. We want to hold government accountable, and we know that there are government actors who are trying, and there are government actors who must do more. Compared to other public health issues, already having government in the message as part of the problem and solution is good news. In some other issues, it's a hurdle just to get that into the news. But we want to be specific about which government actors and agencies must act. We know the news and sometimes the public sort of lump everyone together from the local, state, local, county, regional, state, and federal level can all just be lumped into government. And then everyone from a public health department to a city council member can sort of be lumped together. And so, we still want to be concise when we're delivering our messages, but if we can be specific about who needs to take which actions, who needs to be accountable, it can help people understand, and it can help put that pressure on the actors that must act. And then the next bullet, and we do have some folks on the call that we took this information from. That polling shows that people are increasingly aware that there's a housing crisis, and they're open to government being part of the solution. This came from some research from Community Change, Policy Link, and Race Forward. And so this is a moment where we can insert solutions that are scaled up, where we're really calling on government to do what they should be doing and to be accountable for racial equity. The public is open to it based on polling, and it's up to us to put these solutions into the news so that people understand them. And then finally, this is where we really view some, concrete, timely work on housing campaigns to long-term visions for change, which is where a lot of the narrative research can come in about how we're articulating what we want, our vision for healthy communities, healthy states, a healthy country, for equity, for justice, for liberation, really tying any current timely battle to these long-term visions for change, and thinking about how this policy goal, how am I talking about it in a way that sets me up for my next policy goal and the policy goal after that, and really trying to shift the narrative on housing and how we think about it, and how we think about the role of government in that. And so those are our, we can go to the next slide, our 4 recommendations and areas. There's a lot more in the report. Part of what we wanted to do today is just introduce some of these media advocacy tools, like the layers of strategy, the message development tool, and the report. and then give an overview of this research. And to summarize again, we want to bring racial and health equity into the frame. We want to connect housing to health in the context of COVID, but also beyond that. We want to position the characters in the frame to broaden it around housing, and we want to expand the frame around the role of government. And so we're starting to get questions in the chat, and we're also curious about what surprised you, what you wanted to learn more about. And I think with that, we can go to Q&A. I already know there's one person who wanted to just mention a great new resource that is out. The Human Impact Partners is a close partner, and I think Will is on here. If you want to unmute yourself, Will.
I know.
Say Sophie's going to talk about it. Sophie.
Sophie.
I used to work for a school like that.
Hi, folks. Sophie Cinnamon Ortiz with Human Impact Partners. I hope you can hear me okay. Sorry, there's some noise outside. Hi, just really quickly, just to add on, and thank you so much, Kathy, and everybody, to add to all the great resources shared today. We wanted to just give a quick heads up announcement that this coming Tuesday, we're going to be releasing a related toolkit and additional resource around this intersection as well. Both Housing Now and BMSG contributed greatly to it. And it's a resource we're putting out that's a health and housing communications and also data access toolkit. Well, we want, we've done a range of work in terms of advocacy at this intersection as well as research, and we wanted to, and they've often been tied to specific campaigns over the last few years. We wanted to create something that was kind of evergreen and usable, that compiled some of these talking points and learnings. And what it has is it's talking points that incorporate some of the most up-to-date research, also from public health evidence, including evidence developed by folks here on this call, and building off of all the great work of organizers and advocates over the last couple of years. So it has that updated research, and then it also has a whole section around how to access data, including in your local context, to really tell the story of health and housing together. And again, Housing Now contributed greatly, BMSG, thank you so much. And additional advisors were Tomas Rivera from Chainbreaker in New Mexico, and Lupe Areola from Tenants Together, who many of you probably know as well. So again, Tuesday, that's coming out. If you aren't already on our Human Impact Partners email list and would love to receive it, can drop me an email and I'll make sure that that we get that to you. Thanks.
Thanks, Sophie. And feel free to put your email and HIP's website into the chat. So I want to move to questions. We have one from Alina. Did you all look into, were you able to see any regional state trends that differed from the national trends? And I'll turn this over to Pam and Kim. I do want to mention we have another resource which we can put into the chat, which is a quantitative assessment of news from each of the 22 areas. And Kim and Pam will talk more about that.
Sure. Great question. And I'll also turn this over to Kim if she would like to say anything. One thing that Kim flagged in her comments was that we did notice a marked I want to say increase, but that's not the right word. We did notice that there were markedly more unhoused folks who were quoted in stories from the Philadelphia Inquirer and from the Seattle outlet that we looked at, which was, an interesting finding. Because of our sampling and because we were looking at really one media market one media outlet per market, I'm hesitant to speculate too far as to regional trends, only because we can really only speak to what one particular outlet might be doing or saying in a particular context. But I would say take a look at the quantitative analyses. You will see some interesting ups and downs, and I'm also very happy to, there's 22 of them. So if you don't feel like looking through them all, just send me an email and we can chat about them. I love talking about research. I'll put my email in the chat as well for anyone who has questions about our methods or anything of that nature. We did notice a couple of things in the quantitative analyses that would go back and forth. For instance, overarchingly across the country, issues of issues relating specifically to unhoused communities tended to dominate, but there were a few cities, Hartford, Connecticut, Dallas, Texas, and a couple of others, where the focus was actually more on affordable housing creation and provision and tenant protections. So we would see a little bit of kind of the differences in topics, or the topics that tended to dominate housing coverage, shifting a little bit in those media markets around the area. Cam, I didn't know if you had anything else you wanted to kind of lift up about any trends that we can see. As you can see, this is never ask me a question about my data because I'll talk forever. So I'm going to try to.
You nailed it, Pam. Yeah, I was going to say, because we really were only able to capture one outlet per media market, it would be hard to say any state or regional trends, but certainly we did see some variations in the different areas that were covered that Pam just mentioned.
Wonderful. So yes, please don't hesitate to reach out to us. We'll be happy to talk more about that data. I see a lot of interesting questions coming up in the chat as well. So I do want to make sure to stop, but I will be happy to keep digging in.
And I'll just add to that, one of the most time-consuming parts of the analysis is building a code book so that that our staff can come to agreement on how to code different news articles. And so that was a big part of this project. Now that we have that done, it would be easier to do more in-depth analyses. So we'd love to look at regional trends and do more in the future. So there's a question from Jane. Great question. Could you please address the description of housing shortage versus housing affordability shortage that is perpetuated by government and media? Great question. So we worked with the Council of Community Housing Organizations, who's also on the call, and the Bay Area Regional Health Inequities Initiative, where Will used to be, and he is here. We are going to have a journalist toolkit coming out soon about reporting on housing, and we go more into this in the toolkit about how journalists can ask questions that get to this nuance. I think one of the overarching tensions around housing policy is it's so complex that when you start to get into these nuances, it's really easy to fall into jargon and to talk in a way that most people will not understand what is meant by this. So one, I would say we need to find ways to be able to describe the nuance between housing shortage versus housing ability shortage that's clear, concise, and doesn't include jargon. But we do know that we see, and we often see, and what we talk about in the toolkit for journalists is that it's overly simplified, when journalists report, they're often just talking about a general housing shortage, but they don't get into that there is particular shortages at specific income levels. And I'm most familiar with California, but that, all of our assessments show that there is more market and luxury housing being developed and not enough affordable housing being developed. And that when we fight for that, that is when we get a lot of the NIMBYism in the news. And so I do think that these 4 recommendations we have are a bit overarching. They don't get this nuanced, but preparing spokespeople, using the message development worksheet, being clear on your overall strategy, what is your goal? And if your goal is to talk about housing affordability shortages, then really trying to find messengers and messages that make that easy to understand, and probably don't use those terms because I don't think a lot of lay people are going to know what those mean. And so that is going to include a lot of practice. One of the things we say at BMSG is try to show, not tell. And so if there's a way to show what inequity is, or show what a housing affordability shortage is by a story, by data, by trends, that is easier for people to start to see what that term means in a real and concrete way. But very good point, and it's tough. So I would say it's a longer discussion of what the actual message would be based on the policy goal. I am just scrolling down. Okay. When we frame for government responsibility, oh yeah, this is Charlie from the Choo Choo who we're doing the toolkit with, how to decenter the lens of government deregulation and center the expansion of public investment. I don't know, Pam and Kim, if you want to tackle any of that, or if you want me to.
If
Kathy, I can jump in if you want.
Sure. Oh, and our director, Lori Dorfman.
Hi, everyone. It's just so nice to see you all and see the response to this fine work that the research team did. It's really outstanding. I think that's an excellent question about how the role of government is portrayed, and it's enormously important, since if we're really going to get to scale, it is going to require government doing its business the way it should in response to what communities need. And so one way to flip it, I think, is to talk about give primacy to the responsibility of government. Government is us. We elect people, and then people get appointed to fulfill the needs of community. And I think taking that high road and emphasizing what government's responsibility is to the community is a way to derail that devolution emphasis in government. And I think it's tricky because you don't want to do, you don't want an elephant trigger, what we call an elephant trigger, the idea of triggering the opposition's argument and including that. So you want to stay away from that. So I wouldn't really talk about the emphasis on deregulation. I would talk about what the responsibility of government is to the communities that it serves.
And I would just add to that, going back to some of the previous slides, the one on government, thinking about our vision for long term. I know there's some folks on the call who are really looking at like social housing and how we build the momentum for that, so that's a very long-term vision. And so, thinking about if that's your long-term policy goal and you're having, concrete policy battles along the way, thinking about how each sort of campaign can shift how we think about the role of government and housing. We know at times in this country, government supported public housing of social housing was accepted and was a big driving force. And so it is hard to move back towards that again, but I think that's where the work on concrete campaigns ties into a lot of this narrative change work, that research that's happening. So if that's our vision, if we want people to think of housing as a social good, as something that's foundational for health, rather than just an individual commodity, then that needs to be part of our messages for every single campaign. And it can be very hard to weave that in when you're in the hot seat and a reporter's asking you a lot of questions, or when you have 600 words in an op-ed. And so I think, again, unfortunately, it's not just one easy answer, but it's going back to your goal. What's your strategy? What are you trying to achieve? And then your messages, how do you get that into this specific campaign? What messengers can get it across? And really trying to build that article by article, op-ed by op-ed. Okay. Did you see, oh, hi, Peter, also formerly from Choo Choo. Did you see any mention of income and wealth disparities and inequities at the intersection with or truly underlying housing insecurities and related racial and health inequities? Kim and Pam, do you have any information on this?
This is a great question, and I have to be honest, I'm looking through this. I'm looking through our findings right this moment. So maybe, do you mind if we move to the next question and just give me a chance to look around and double back?
Yes.
Thanks.
Another question. We have a city council board of supervisors who get upset when you point out racial equity and discussing housing solutions. How would you suggest one continues to frame both the need for racial equity and a solution if local politicians continue to ignore this? My initial thought is to say they are ignoring this, but imagining reporters might focus on that than the solution. Yeah, we definitely see this a lot. And again, it's why we really encourage people to go back to the layers of strategy and really think through your particular campaign and how it builds towards a longer narrative change. When we were talking about that slide about media advocacy versus social marketing, again, as advocates, our job is to pressure our electeds and our government to do what is necessary for health. And we know that racial equity is a huge part of that. So we believe firmly that we have to be trying to get racial equity into the conversation. But depending on the context, there's a lot of different ways you can do that. In our layers of strategy, we talk about the allies that you might be working with. Sometimes a government agency like a public health department can provide data that is very clear that there's racial inequities in housing and health. And then we can think about community partners who might be able to raise the issue more explicitly and really talk about solutions that focus on racial equity. In the report, we also mention Heather McGee's The Sum of Us, where she really gives a lot of examples about how racial equity is something that benefits all of us. And we think there's a lot of opportunity to use messaging like that. Also knowing that it is, you know, a long haul and that there's going to be pushback. If there's city council members or supervisors who are more supportive, trying to get as much information from them about what political cover would help them advance the policies that we know can create health. Or working with our coalition to be really strategic about how, you know, one of the things anyone who knows me knows I love to power map, but when you break down your board of supervisors or your city council onto that map, and if you haven't heard of it before, there's power analysis, power mapping, you really start to target, you know, who might be a champion, who is your opposition. And a lot of times it's tempting to try to put our messages geared towards the opposition because they're so loud and they're so confrontational. But when we do that, we're missing our base. And so especially when it's in between, you know, when it's not a ballot issue, but it's, you know, trying to convince the city council or the board to vote a certain way. And it's about mobilizing our base to show up to those Zoom meetings or those in-person meetings. It's really about using the values and the messages that will resonate with our base rather than trying to water them down to something that the opposition, who might have vested interest in opposing these policies, is going to find palatable. I don't know if anyone else from BMSG wants to add anything to that.
No, beautifully said. I would love to return to Peter's question if I could briefly, about data. So sorry to loop around here, but I think it's a really fascinating question that you raised, Peter, and I want to just revisit it for those in the chat. Peter had asked, do you see some or any mention of income and wealth disparities or inequities as intersecting with a truly underlying housing insecurities, related health and racial inequities? And apologies, by the way, my neighbors have again chosen to do yard work right this very moment, so it's very loud here. The short answer is yes, but in a very limited way that is connected with COVID. So what we saw is that when we saw, by and large, what we saw is that when we saw references to income and wealth disparities referenced, it was in the context of COVID kind of either creating or exacerbating those inequities. So what we saw most often was that articles would talk about how COVID had either, as I say, created, like it was just out of nowhere that people all of a sudden were struggling economically, or occasionally, very, very rarely would we see comments like quotes, like for instance, Trenton, a housing advocate based in Trenton, who observed that many of his clients, quote, were struggling even before COVID to make the rent payment. So that was a much more rare example compared to the sort of out of nowhere act of, for lack of a better term, act of God framing around the pandemic that tended to frame the pandemic, COVID itself, as really causing inequities in income that then, you know, affected housing outcomes. So happy to talk more about that. That's a trend we've seen repeated in several different studies we've done now, where housing, like inequities in income are named, but again, they're often very much directly attributed to the pandemic, rather than framed as an ongoing issue that perhaps was exacerbated, or was indeed exacerbated by the global crisis. Kim, I didn't know if you had any other thoughts, or you know, Kathy, Lori, anybody else who wanted to weigh in on that. Great question, though, and very much appreciate that. That's definitely was something that we were really interested in understanding, is again the extent to which we were talking about deep-seated inequities versus sort of a sudden out of nowhere cause. You know, the pandemic is a sudden out of nowhere impetus for you know, heretofore unheard of problems.
So we're getting down to the last few minutes. I love how all of the questions, I think housing and health folks are just so passionate. I'm glad you're bringing that here. Want to just try to wrap up a few questions as we go to the next slide, which has some resources. One is, do schools of public health collaborate with schools of journalism to educate journalists on housing, health, racial equity issues? Yes, absolutely. Some of the best reporting I've seen on some of this comes from students. And so when we're thinking about, so we have, again, I know we keep going back to it, but it is the foundation of our work, the layers of strategy. We have the overall strategy, the media strategy, strategy, the message, and the access strategy. Sometimes a media outlet like a student, like a UC or a university newspaper, because the students are taking a lot of time to investigate and to write, and a lot of them are coming to the schools to be passionate about these issues, they might be more willing to give a more nuanced view about these issues. So it's a great place to pitch, especially if your issue hasn't been in the news. Then it could be a great starting point, and then you can reuse that news at, if they write a great article and try to get it in front of other folks and say, hey, these students from UC Berkeley wrote on this, but the San Francisco Chronicle hasn't even covered it. Why not? And pitch it that way. Also, the trend on politicians embracing new housing development, even if it's not truly affordable. What are some strategies? Huge question with just a few minutes left, but there's some great answers in the chat. I would just say, again, for us, part of it is going back to that overall strategy. And some of the strategies for addressing and reversing this trend are not going to be communication strategies. They're going to be your organizing strategy or your policy strategy. And you're going to have to figure out with your coalition, how do we chip away at this? Or how do, what are the policies that we would really get affordable housing preserved, protected, and built in our communities, and being very clear what your policy goals are, and then moving to your communication. The more clarity you have in that policy goal, the easier it'll be to hold the politicians accountable and say, okay, you're at these ribbon cuttings, but it's luxury housing. What are you doing for these community members? What are you doing for these community members? And to use the media to be very specific about what you want. And use some of the tools. So I know that is a very quick answer to a very big question, but I just wanted to give a few, the last minute to Francisco or Pam or Kim or Lori to wrap it up if anyone else has anything to add.
Thank you. Also it's a loud background here, but I'll just put my email in the chat, and if folks would like to be added to our email list, please let us know. Thanks so much.
Thank you, everyone. Really appreciate it. Feel free to reach out. Our information is here. Francisco's putting his information in the chat. We'd love to hear, if you get a chance to look at the document and find it helpful, we'd love to know that. And if there's questions you have or things that you think we could create that would be more helpful, we'd also love to hear that too. And just want to really appreciate all the work. It's amazing to have all of you on here. And to know that we're part of a movement for housing justice, racial equity, and health equity across the country, and just really honor the work you're doing on the ground every day. And thank you for making time. And we look forward to staying connected.
Thank you.
You mentioned a book that's being released tomorrow or soon. How do we access that, or is that something you'll automatically send to this group?
So our resource, there's a link in the report, and I think the one that you might be talking about is from our partners at Human Impact Partners. And Sophie, I think, put her email in the chat. But if I'm just trying to scroll.
I can put my email to
okay.
Eugenia. I can put my email now, and they're welcome to get in touch, and we'll send it. Oh no, Sophie's is in there too.
Okay. So that's one connecting housing and health as well. The Housing Reporters Toolkit will probably be hopefully released in the next month. And if you want to put your email in the chat, or I should have it from the registration, I can add you to our listservs. We always put all of our new resources out on, we have a daily listserv of issues in the news. We have a more sporadic listserv when we have new resources, and we always post on social media. So we'd be happy to get that to you. Great. I will make sure you get that. And I think we still have a few other people. Feel free, if you have any resources, share them.
Hi, this is Sonia Gray Hunt. I do apologize. I had to maneuver through a few things. Sonia Gray Hunt with COPE. You will be sharing out the PowerPoints or any recordings?
Yes, we can send the recording and a PDF of the PowerPoint to everyone who registered. So as long as we have you registered, we'll send it to you.
Okay, thank you, ma'am. Thank you so much for the work you do.
Thank you as well. And META has a project about advancing health equity through housing. I'm in the mission, so I'm a big fan of META. So glad you find this helpful. And it's great that it's CDPH, California Department of Public Health supported. We'd love to hear more about it.
Okay, you're talking to someone else.
Oh, sorry.
Okay, you have a blessed one. Bye-bye.
Norma wrote a comment in the chat. Yeah, definitely great conversation.
Yeah, I do apologize. COPE is planning for a public action around the mass displacements that's taking place and calling for, more rapid temporary housing. So we're planning for that. So I was kind of like maneuvering through a few things, but I'll look through the PowerPoint and everything and the recording. And thank you so much. Have a blessed day. Bye-bye.
Thank you. Francisco's been filling us in on what happens. We wish you a lot of luck, and feel free to reach out to us if there's ways that we can support.
Thank you so very much. Greatly appreciate that.
Yes.
Thank you, Francisco. Okay, bye-bye.
Bruce, it's nice to see you on here. Yes, we will send the recording and the slide deck. All right.
Ready, folks. Thank you so much, BMSG team. I think everybody says they had a great, learned a lot and had a great experience. When you all have the recording and the slide deck, let me know, and then we'll send it out to everybody as well.
Great.
Good. Thank you so much.
Thank you. I think we may just, Francisco, I don't know if you want to stick around. We could do a quick debrief.
Yeah, happy to.
Okay. As people are leaving.
The recording, I think.
Okay.